Welcome, everyone. Today, we're tackling a topic that's close to my heart disease in the United States. It's a silent epidemic, often lurking undetected until it's too late. We'll delve into the science, look at the statistics, and uncover the why behind it all. Most importantly, we'll explore what you can do to protect yourself. Let's start with something we can all relate to: food. The standard American diet is overloaded with saturated and trans fats, cholesterol, sodium, and added sugars. These dietary villains are like ticking time bombs for your heart. Over time, they contribute to clogged arteries, high blood pressure, and inflammation, all major risk factors for heart disease. A diet high in these harmful substances is like pouring grease down the drain. It leads to a buildup of plaque that narrows the arteries, restricting blood flow and increasing the risk of heart attack and stroke. Opt for fresh fruits and vegetables, lean proteins, whole grains, and healthy fats. Your heart will thank you. In our fast-paced world, it's easy to fall into a sedentary lifestyle. Long hours at desk jobs, commutes in cars, and evenings spent in front of screens have become the norm. Think of physical activity as medication for your heart. When you move, you strengthen your heart muscle, improve blood flow, and lower your risk of heart disease. Conversely, lack of exercise is like a slow poison. It increases your risk of obesity, high blood pressure, high cholesterol, and type 2 diabetes. Aim for at least 30 minutes of moderate-intensity exercise most days of the week. A brisk walk, a bike ride, even dancing in your living room. It all counts. We often hear about the obesity epidemic in America, and for good reason. Carrying excess weight, especially around the abdomen, puts a tremendous strain on your heart. This can lead to high blood pressure, high cholesterol, and insulin resistance, a precursor to type 2 diabetes. Fat stored around the abdomen, known as visceral fat, is particularly dangerous because it releases hormones and inflammatory substances that damage blood vessels. The good news is that even modest weight loss can have a significant impact on your heart health. By adopting a healthy diet and incorporating regular exercise into your routine, you can shed those extra pounds and reduce your risk. Chapter 4. The silent threat: high blood pressure, also known as hypertension. High blood pressure is often called the silent killer because it usually has no symptoms. You could have it for years without knowing. All the while, it's quietly damaging your heart and blood vessels. High blood pressure is like increasing the speed limit on highways. Over time, the constant high pressure puts stress on the artery walls, causing them to weaken and become more susceptible to damage. This damage can lead to a buildup of plaque, narrowing the arteries and restricting blood flow. Lifestyle modifications, like diet and exercise, can make a big difference. In some cases, medication may also be necessary to keep blood pressure under control. Chapter 5. Up in smoke: the devastating impact of smoking. We all know that smoking is bad for our lungs, but did you know it's just as harmful to our hearts? Nicotine is a stimulant that causes your heart to beat faster and your blood pressure to rise. It also damages the lining of your arteries, making them more susceptible to plaque buildup. The good news is that quitting smoking is one of the best things you can do for your heart health. Your risk of heart disease drops dramatically within just 1 year of quitting. Chapter 6. Drinking to your health. The truth about alcohol and heart disease. A glass of red wine with dinner is often touted for its potential heart-healthy benefits. While moderate alcohol consumption might offer some protection, excessive drinking is a recipe for disaster. Alcohol in excess raises blood pressure, weakens the heart muscle, and contributes to irregular heartbeats. Moderation is key. For women, that means no more than 1 drink per day, and for men, no more than 2. Remember, any amount of alcohol consumption carries some risk. Chapter 7. The cholesterol conundrum: understanding good versus bad cholesterol. Cholesterol often gets a bad rap, but the truth is, our bodies need some cholesterol to function properly. The problem arises when we have too much of the wrong kind of cholesterol. There are 2 main types: LDL, which stands for low-density lipoprotein, and HDL, which stands for high-density lipoprotein. Think of LDL as the bad cholesterol. High levels of LDL cholesterol contribute to plaque buildup in the arteries, increasing the risk of heart attack and stroke. HDL, on the other hand, is the good cholesterol. A healthy diet low in saturated and trans fats can help lower LDL cholesterol and raise HDL cholesterol. Diabetes, a metabolic disorder that affects how our bodies use glucose, is a major risk factor for heart disease. When blood sugar levels are consistently high, it damages blood vessels and nerves throughout the body, including those that supply the heart. Over time, this damage can lead to a buildup of plaque in the arteries, increasing the risk of heart attack and stroke. The good news is that both type 2 diabetes and insulin resistance are often preventable with lifestyle changes. A healthy diet, regular exercise, and maintaining a healthy weight can significantly reduce your risk. We all experience stress from time to time, but when stress becomes chronic, it takes a toll on our physical and mental health, including our hearts. When we're stressed, our bodies release hormones like adrenaline and cortisol. Over time, chronic stress can contribute to high blood pressure, high cholesterol, and an increased risk of blood clots. Exercise, relaxation techniques like yoga or meditation, and spending time in nature are all great ways to de-stress and promote heart health. While lifestyle choices play a significant role in heart health, genetics also play a part. If you have a family history of heart disease, you're at an increased risk, even if you live a healthy lifestyle. You can't change your genes, but knowing your family history can empower you to take proactive steps to protect your heart. If you have a family history of heart disease, talk to your doctor. By understanding your family history and making healthy choices, you can take control of your heart health. Thank you for joining me on this journey into the heart of America's health. Remember, heart disease is largely preventable. By understanding the risks and making positive changes to your lifestyle, you can significantly reduce your risk and live a longer, healthier life. Don't forget to like, share, and subscribe for more health tips and information. Until next time, be well.